All right, last up is me. Again, I'm Dr. Mundy. I'm our Women's Mental Health Champion, and I'm going to be speaking about perinatal depression and anxiety. I realize that these are very broad topics, so this is going to be kind of a quick overview. And the intention, much like Dr. Serino said, is to really alert you all to the resources that are available to you so that you can access them. Something that we see a lot is women veterans just simply not being aware of what's available to them. Okay, so the first thing I want to point out is that having a baby is a huge adjustment for everybody. And that's fine. That is a normal thing that is oftentimes, unfortunately, not normalized. We know that as much as 80% of women experience some brief negative mood changes following giving birth. And we refer to those more specifically as the baby blues. These usually begin about 3 to 5 days after delivery and last for 2 to 3 weeks. During this time, we see an intensity in mood symptoms, so people just feel their moods more acutely. And some of the common symptoms associated with the baby blues would be things like irritability, just more easily frustrated, crying more frequently, difficulty concentrating, and just an overall increase in anxiety. Again, these are normal, and as long as they resolve, then that 2 to 3 week period, then you don't really have anything to be particularly concerned about. There are some things you can do, though, to help minimize the baby blues symptoms. And really, the kind of summary here would be just take good care of yourself, which can be particularly challenging when you've just had a baby and you have another human that's fully dependent upon you. But some of the kind of key things you might want to take into account that will help manage the baby blues. First is knowing what to expect, which you all are already learning today just by being here, so that your expectations are accurate, which then can help you be kinder to yourself and not be surprised when this is hard. Prioritizing sleep, which can be really tricky when you have a newborn, but maybe that involves having a family member or a loved one stay over for several weeks to help with nighttime feedings, or to help watch the baby during the day so that you can sleep. Getting out of the house as you're able, kind of accessing what feels like the real world out there, normal life. I already talked about adjusting expectations. So the idea of if you expect yourself to manage this or do this perfectly, probably going to be sorely disappointed because it's just a tremendous adjustment. And that goes along with the final tip here, which is practicing self-compassion, extending kindness and gentleness towards yourself during this big adjustment. And then asking for help. Oftentimes, I think, especially with women, we have this idea that we have to do it all and be it all. And none of us are capable of doing that. So don't be afraid to ask for help and invite it into your life during this time of adjustment. So some things to keep in mind if you're wondering, do I have baby blues, or maybe am I struggling with, a diagnosable depression? These are some things that might distinguish the two. So if you're unable to sleep, even when the baby sleeps, that could be a sign of depression. Without depression, hopefully, when the baby's sleeping, you're going to be so tired you'll be able to sleep as well. Fatigue and poor concentration that persist even when you're getting adequate sleep is another warning sign. If you're gaining more weight than expected or you lose significant weight, that's another concern. And then lack of interest in food, or the opposite, really indulging as a form of comfort, that can be another sign of depression. There's a lot of risk factors for perinatal depression, and I don't put these on the slide to be depressing, but hopefully to just help increase your awareness so that if you fall into a lot of these categories, you can be on the lookout for them. Prevention is almost always better than intervention if possible. So it's just knowledge is power kind of thing. I'm not going to read all these because y'all can read them, but some things to highlight. There is a bit of a genetic component to perinatal depression. So you may want to ask, mom, grandma, if she had these types of symptoms. Pain conditions just make pregnancy and postpartum a lot more difficult to manage, which then can make you at increased risk for depression. If you have major sleep issues, that's another challenge. Dr. Serino also said MST history, which does increase your risk for depression during and following pregnancy. Also, recent active duty. So if you got out of the military recently, for a range of reasons, that will increase your likelihood of experiencing depression during and after pregnancy. The good news is we have a lot of really helpful and effective treatment options for perinatal depression. Some of the key ones are evidence-based therapies like CBT and IPT. Also, just learning to really challenge your thoughts and therefore your expectations. So, assuming that oftentimes when we're out in public and the baby's crying, we might jump to a conclusion that people are judging us or thinking we're a terrible mom, which is usually not the case. Making sure you challenge those beliefs. Making sure you're realistic with yourself about what kind of responsibilities you're taking on. And there's a concept called maternal role idealization, which essentially means we have this sort of perfect image in our mind of what a mom is, and undoubtedly we won't live up to it. So challenging that kind of image of perfection. Social support is essential. So connecting to people that love you and care for you, having people around that can be helpful. Exercise, for a wide range of reasons, is really useful, especially in the postpartum period for managing and also preventing depression. And then being flexible with breastfeeding. Women in general tend to put a lot of pressure on ourselves. We have to breastfeed for this amount of time. And as Laura said, really fed is best. Sometimes it's going to be better for the baby for you to be healthy and well than to force breastfeeding when it's causing distress. There is a great online treatment program that is evidence-based for women who are struggling with postpartum depression, perinatal depression. The link is here. It's called Mom Mood Booster, and I've also included the phone number, and you can call that number and actually get signed up for the program. Okay, anxiety. So the first thing, again, much like the baby blues, some anxiety around pregnancy and the postpartum period is completely normal. Again, this is a huge shift. Your whole life is really going to change. A lot of added responsibility, changes in maybe your roles or your relationship with loved ones, especially your spouse or your partner. So some worry is just going to happen. If it doesn't, that's almost unusual. I've listed some of the most common worries here. Having a miscarriage is on the top of the list. But there's other things that women worry about, like how am I going to manage my job and my social life and having a baby? Am I going to like my body after I give birth? Am I going to still be healthy? Am I going to be able to manage the financial cost associated with motherhood? So how do we manage pregnancy-related anxiety? And my caveat here is much of pregnancy-related anxiety can be quite normal, but if you feel like you're really struggling with it or it's getting in the way of your everyday life, you're not maybe able to engage in work or take good care of yourself or maintain relationships, then it can be really important to reach out for help. Therapy, of course, evidence-based therapy is one approach that can be quite useful. And I've listed some things here that this form of therapy you may want to focus on during your course of therapy. So things about labor. Am I fearing labor? Can we dispel some of those myths? Accepting pregnancy and the changes this will bring. Therapy can be useful for talking through or navigating how my relationship, especially my relationship with my partner, going to change after giving birth. Yoga has a good deal of research to show that it's quite effective adjunctive treatment for anxiety during pregnancy. Really just helps move us out of that fight-flight state that's associated with anxiety, calms our overall nervous system, helps us think more clearly. There's a lot of good online yoga resources specific to pregnancy and postpartum, and I've linked some of those here. There is a specific form of anxiety during pregnancy that's called tocophobia. Sounds really concerning, but all it means is an extreme fear of childbirth. There's some various factors that can make this more likely. And usually the most common one is that you had a previous pregnancy that was traumatic or a previous traumatic childbirth. Some of the other factors to consider would be if it's your first pregnancy, if you're single, you don't have adequate support, younger mothers tend to be more likely to struggle with this particular form of anxiety. And again, this is extreme fear of childbirth. I can't imagine any woman is not somewhat fearful of childbirth, but extreme to the extent that you're thinking about it constantly, it's getting in the way of you functioning. CBT is a huge and the most effective form of therapy for this particular anxiety condition, and just making sure you have a lot of support during labor and delivery. Another specific anxiety disorder that can come up during pregnancy is adult separation anxiety disorder, which essentially involves extreme anxiety when you're separated from your baby, like maybe when you had to take the baby to daycare, or you never let somebody else take care of the baby because you're really concerned something bad will happen. This can be triggered by previous pregnancy losses or just a trauma histories, other types of losses. And not surprisingly, CBT or cognitive behavioral therapy is usually the most effective form of treatment here. Couples and family therapy can also be useful if your difficulty being separated from the baby is making your relationship with a partner challenging. Panic disorder is those really intense, when you have recurrent panic attacks, which are those really intense periods of anxiety where people often say they feel like they're having a heart attack. It's interesting to note that most women that have panic disorder prior to pregnancy do not experience a worsening of symptoms during pregnancy, which is unlike some of the other conditions we've discussed. So just because you have panic attacks now, there's no real evidence-based reason to believe that those symptoms are going to increase when you're pregnant. There's a little bit of an increased risk of an increase of panic symptoms after pregnancy, so in the postpartum period. Distraction can be good when you're managing panic type symptoms so that you're not focusing intensely on your physical sensations. Of course, any kind of mindfulness or relaxation techniques, really working not to avoid, because avoidance feels good in the short term, but tends to make these symptoms worse in the long term. And then challenging your unhelpful thinking about the symptoms themselves. CBT is really, again, the evidence-based treatment for this. So in summary, we want you to know that we have a wide range of evidence-based treatment options for women veterans at Ralph H. Johnson. You can get engaged with these services in a few ways. You can simply talk to your primary care provider. Any one of them will be able to refer you to mental health. Feel free to contact me. My contact information is on the very last slide. I'll just reiterate, though, that really the easiest way to contact me is to go into My Healthy Vet and send a secure message to Women Mental Health Champion. That will come right to me, and I'd be happy to assist you. Overview of some of the women-only therapy groups that we have, and we are working to increase these. I'm not going to detail every one of them because you can see the slides clearly, but they range from focus on trauma, specifically sexual trauma, stress management, and we have a pain group as well. Lots of resources that I've linked here. I do want to highlight the Veterans Crisis Line, 24/7 resource if you're having thoughts of harming yourself. Also, there is a text and a chat option with that, as well as the Women Veteran Call Center. So if you're really looking to contact or make contact with somebody who's an expert on all things women veteran healthcare, that's a good place to start. Just again, my contact information, you can send me a secure message. Feel free to call me, although I will tell you that sometimes I think phone is a little sketchier in terms of actually reaching the person you're looking for. So that's why I recommend secure messaging. In closing, we really are appreciative that you've all joined us today. We hope we're leaving you with some good resources that will help make your pregnancy and postpartum experience smoother and more positive and hopeful. If you have further questions, reach out as always to me. I can easily connect you with any of the people that have presented today. I know I do want to leave just a few minutes for questions. Is there any specific question or issue we could address for you before we close today?